Hi there. Um, my name is Crystal Buckingham. I want to first and foremost apologize for the crazy headphones. I'm having technical difficulties with my webcam and the volume. So this is my evidence-based project. I chose to focus on quality improvement, specifically in regards to improving pain reevaluation compliance and documentation. Um, the project takes place on the unit that I work at, which is an inpatient post-surgical unit at John Muir and Walnut Creek. The overall goal of the project was to increase pain reassessment documentation and by doing so improve patient outcomes. I wanted to take a moment to talk about why I decided to focus on pain reassessment compliance. First and foremost, I work on a post surgical floor. So, patient safety and patient outcomes are huge factors on our unit, and adequate pain management has a huge effect on both those things. In regards to patient outcomes, each patient's pain interventions are different, and by performing adequate reassessments, we ensure that we're adequately managing each patient's pain unique to their individual needs. Inadequate pain management can have severe effects on patient outcomes. According to an article published by the Patient Safety and Quality, inadequately managed pain can lead to adverse effects, including poor wound healing, increased post surgical infections, GI complications, and reduced post surgical mobility. In regards to safety, the Joint Commission states that appropriately reassessing pain according to best practice time intervals decreases the risk of over medicating patients and reduces the risk of opioid related respiratory depression. It also reduces the risk of under-medicating patients, which can lead to adverse effects such as hypertension and increased length of hospital stays. And then finally, in regards to standards of care, certain regulatory bodies require hospitals to follow specific parameters related to pain management to remain compliant. For example, the Joint Commission, they state that an accurate pain screening and reassessment is a foundation in which an individualized, effective pain management plan is developed. And hospitals are required to develop their own means of pain management and individualized to their patient population. And then, in addition to that, John Muir Walnut Creek holds a Magnet accreditation, which is an award that demonstrates excellence in nursing practice and high quality of patient care. One of the foundations of maintaining a Magnet accreditation is continuous improvements. This includes in reassessment rates, pain management and documentation, and patient satisfaction and patient outcomes. So, in order to achieve my goals of this project, I set out a few objectives. Firstly, it was to assess current practices in relation to pain reassessment timelines and comparing this to John Muir's current practice. The Joint Commission states that pain reassessment timelines may differ based on patient's age, condition, and their ability to understand pain. So, current best practice follows pharmacological recommendations based on peak effects of medication, which includes 15 to 30 minutes for IV administration and within 1 hour for oral administration. After reviewing our policy and procedures, I found that John Muir follows both of these recommendations. The second objective was I needed to obtain baseline data for 5 West pain reassessment compliance pre-intervention. And at the start of the project, we are at 82% of pain reassessment compliance. And then finally, my final objective was to find a way to increase compliance rates for pain reassessment documentation. Due to time constraints, I wanted to start off with a small objective. So I decided on a goal of at least 5% increase from our baseline data over a 3-week intervention period. When I was researching ways to improve compliance data, I came across a study by the Journal of Emergency Nursing, in which pain reassessment documentation rates increased after the implementation of daily audits and being transparent with their data. The study took place at Margaret Hospital Emergency Department over an 8-month period. It audited individual nurses and their compliance to pain reassessment documentation, and then it also provided education for expected times of pain reassessment and the importance of reassessing pain. Due to time constraints and my ability to not be on our unit every day of the week, I decided to change my project to implement it through weekly audits. My supervisor and I also decided we didn't want to single out individual nurses, so we were collecting data from the unit as a whole. I decided the best way to be transparent with the data was to introduce the percentage into our daily huddle. Um, and then I also wanted to include information on what our expected time for pain reassessment documentation was. To do this, I printed information sheets regarding pain reassessment, and then I also held in services to answer information or any questions that my nurses might have had. Um, And then materials developed. I encountered a small hang up with this one because I work in such a big hospital. Any pamphlets that I wanted to create would have had to go through our board and be pre-approved before I could post them on the unit. And because we only had less than a month to implement the project, I didn't have the time to do that. So instead, my professional development specialist helped me pick out pamphlets that were already created, and I posted those around the unit just as a reminder to nurses. I also took a look at our pain policies and used those to create a little blurb to include in our morning huddles. So these are examples of the posters that I posted around the unit. It just has information about safe opioid management and expected time frames for pain reassessment documentation. And then these are 2 pages from our pain policy. I didn't post the whole thing because it was 19 pages, but it does mention pain reassessment timelines, what is included in our pain reassessment documentation. And then lastly, this is just what I included in our morning huddle. So it just told everyone that we are trying to increase our compliance by being transparent with our data. And then each week we would update our percentage to show nurses how we were doing. And then it also included a reminder for pain reassessment timelines for IV and oral pain medications. Anticipated benefits of the study, as mentioned earlier, better patient outcomes, increased patient satisfaction, increased documentation rates, safer use of opioid medications, so lowering the risk of respiratory depression, lowering the risk of over-medicating patients. Also hoping that being more compliant with pain reassessment, we could decrease length of hospital stays, and then in effect lower healthcare costs. Anticipated challenges, first and foremost, were time constraints. A lot of nurses working on a 5-to-1 patient ratio, they will check in with patients regarding their pain reassessment, but they won't always document it. And then float pool staff, sometimes we have nurses come in from other units to cover short staff, and they're not always familiar with our unit's protocols and everything, so that skewed our data a little bit. And then accountability and interest. So because we were doing a pool of all of the nurses and not individuals, some might not feel like it's their important to them to do to follow up on pain reassessment. And then missing assessments between shifts. So this included if a nurse were to give a pain intervention before her shift were over, and then the reassessment documentation wasn't followed up by the post night shift nurse. So we just informed nurses to make sure that you were including that in your nurse to nurse report. The stakeholders for this project was anyone that was affected or contributed to the project. I organized it kind of by like level. So upper management and regulatory bodies, that's floor supervisors, physicians, RPDSs, the Joint Commission, Magnet. These are all people that are affect compliance. And then bedside staff, they're more in charge of like nurses would be completing the pain reassessments. Physical therapists and CNAs are affected by appropriate pain management. If the patient's pain isn't appropriately managed, then they're less likely to want to work with the CNAs and the physical therapists. And then lastly, patients and patients' families. They're affected the most by pain reassessment compliance and documentation because if we are um, doing this continuously, then we're more likely to manage their pain more appropriately. This is just some information on resources needed and hypothetical costs. We weren't doing this on the clock, so this was kind of just estimated and theoretical. The cost of the program is relatively cost effective when taking into account documented savings in relation to increased hospital stays and poor patient outcomes or readmission due to pain management. The cost of doing nothing is difficult to decipher, but I found one article that stated the total incremental cost of healthcare due to pain ranged from 261 to 300 billion, and that wasn't including days of work missed due to prolonged hospital stays. So the study outcomes, I did meet all of my objectives. The project success was um, evaluated using our EHR. So we pulled pre-intervention data and then weekly post-intervention data for the unit's pain reassessment documentation and compared the two. Um, Although any improvements is beneficial to the patient, the goal was to improve by at least 5%. At the start of the study, we are at 82%, and at the end of the study, we are at 89%. So we did meet our overall goal. Um, Reflection, if I were to do things differently, I definitely would have planned for pre and post surveys, both for the patients and for the nursing staff. For the patient, it would have been focused on whether if they felt like their pain was being adequately managed. And then for the nurse, I would see if they were aware of pain reassessment timelines and the importance of pain reassessment timelines before pre and post intervention. And then lessons learned. Timing is everything with these projects. I definitely fell short for some of my goals, and that put me behind significantly. For example, I wasn't able to collect my last week's data because time restraints, and I should have collected the data today, but my nursing supervisor is on PTO, so I'm technically short a week's data. I think if I had that data, my project would be a lot more effective because it was slowly increasing by weeks of the project. And then, yeah, just staying on task and making sure that I don't fall behind. Here are the references that I mentioned throughout the study and articles about the intervention and why I chose it. And that's it. Thank you so much for watching my evidence-based project.